Our next speaker is Dr. Abdul Hafeez. He is the consultant GP and a founder and a CEO of Apps UK. He's going to share his vision about advancing healthcare in developing countries like Pakistan and the recommendations from Apps UK. Dr. Abdul Hafeez, please.
Assalamu alaikum. Good afternoon, everyone. Very warm welcome from me as well, especially the delegate which has come from Pakistan. I remember the day when we, in the board meeting, discussed this idea of having a conference in London where we interact. And that interaction is between Pakistan, people coming from Pakistan, as well as doctors working in the NHS, as well as in other countries like USA and so on. And obviously this is the dream come true moment. It's the first ever event, and obviously as you've heard before, it's going to get better, it's going to get bigger. Inshallah, we've learned a lot. We've been through so much struggle, as you can appreciate. But I really appreciate Dr. Sohail Chughtai, who's taken the responsibility of being the director of the conference and has really delivered. Organizing such a big event, so many people, is not easy. So there have been some mishaps in the service. But obviously it will get better. I'll come back to what Apps UK really wants to do. You've heard a lot in terms of what NHS is and what, Sehat Kahani has given you some statistics in terms of how the health system work in Pakistan. I personally graduated in Pakistan, and I'm very proud my dean today is sitting here. The idea of having, knowing what's on the ground, and there have been some questions asked in terms of what the real life is like for patients in Pakistan, and this is where APPS UK come in. We are an interface between the health system here as well as the realities of situation and how things can be done differently in Pakistan. I've just given you a brief information in terms of my background and how I have been interacting with different organizations within the NHS, which has given us some unique opportunity in terms of learning from all those different avenues and how these skills can be implemented in Pakistan. I can talk a lot on each one of them. General Medical Council, their procedures, I've been sitting on their panels for last nearly 7 years now. Public Health England and the medical school teaching and so on. But I've got only 4 slides, so I'm not going to take you through a long talk. Very quickly, I'll come to the crunch points. There is a lot what Pakistani system can learn from NHS. Reason being, it's a state-funded system, and with apology to my colleagues from USA, obviously where we believe, obviously system is run by private funding through insurance, but obviously patients are over-investigated and so on. And there's a huge resource within NHS. 12,000 doctors who are working in NHS, and then there are few more thousand who are actually UK-born Pakistani doctors, and they are also providing help. And this is a big resource which Pakistani government should really tap into. And obviously the main ethos, what we believe in, is working in the primary care setting. I'm a primary care physician, so I understand more in terms of even within the UK NHS system, 90% consultations happen in primary care. And I think that's the game changer. And I think Pakistan really needs to focus in this area and how we can prevent. Obviously, we heard brilliant talks in terms of diseases and diabetes and kidney and all that, which is brilliant. But I think there's much more which we need to do at a community level. And some things, some important information which are relevant to my talk, obviously some of them have been already mentioned. A huge number of population live in villages who have no access to healthcare. Whenever we interact with government of Pakistan, we always hear that there is funding issue. But in fact, actually, more than 80% people pay for their treatment. So all government really needs to do is maybe regulate it, the clinics and all that. Waiting list, brain drain, huge issues. Obviously, we cannot resolve everything, but we should do something. And that's where Apps UK come in. And these are just a summary of few recommendations which I want to put forward. We can talk a lot on each one of them, and there may be some other areas. What we believe, in many countries in the world, the medical degree is given after you've completed your house job. While in Pakistan, as soon as you completed 5 years, you get your degree, you pass your assembly, you apply, you're out. Okay? Even within UK now, all new medical students entering medical school will be signing a contract, which is like 4 years you have to serve the UK before you leave, and so on. So this is one of the important areas which we believe will give you, I mean, these are intelligent people who actually pass your assemblies and go abroad, and it's a matter of keeping them and using them. And then making primary care compulsory for them. You know, for example, if there is a 6-month medicine surgery at the moment, and what we believe, if every doctor does 2 weeks in the community center, all those deserted basic health units in remote areas will be actually functional. That will make a huge difference. Keeping medical records, obviously it's dead easy to do. Patient go to one doctor, has CT scan, all investigation, go to a second doctor, have all the tests done again, and go to third doctor and have 3 CT scans in 6 months, waste of resource. All we really need to do is have a medical record, which is dead easy, and I'll come to that in a second again. Compulsory registration of all healthcare facilities, doesn't matter where they are, and then obviously once they are registered, they can be regulated. And this can be done quite easily with a simple motion in the assembly. There should be national complaint procedure where all these regulated institutions can be complained, and they just having a complaint procedure will make them alert. And obviously that improves standard. We talk about patient safety and all that. Revalidation of all doctors. I think even UK was very late in bringing in revalidation. You know, in Pakistan, once you graduate, no test is done. PMDC just give you pay the fee, you get your registration, whether you're sitting at home. We discussed mothers sitting at home and not practicing, and they are de-skilled and so on. Clinical guidelines, we are already working, and I'll come to that in my next slide. And 24-hour patient laboratory, I think backup is very lacking, is a deficient area, and there's a huge investment potential in that area. This is my essentially last slide. What APS UK is doing at the moment, we are running mobile health clinics. And these mobile health clinics obviously is a solution to the rural healthcare problem. So a doctor is picked up from a city, taken to the clinic, he goes to 2 villages in a day, 12 in a week, and then brought back every day. Brilliant service. We have huge important data which we can share if you want. It has made a huge impact. Each clinic is serving 50,000 population. I think within a year we will be having electronic medical record in those clinics. Softwares are specially designed for that purpose. We are already running video link lectures, and these lectures are being delivered as we, even these days in Bennu and other areas where, excuse me, doctors sitting in the UK are able to give lectures. Brilliant program. NHS Direct is a telemedicine center. I mean, people who live in this country, we are aware of NHS 11 service, where any patient can ring in any time of the day and get advice. And this can be done dead easy in Pakistan. You just need a one base where some basic facilities are provided, and then it's a software which provide all the guidance. But the doctor sitting all over the world, from Australia, New Zealand, Middle East, UK, and then going to America, we can provide 24-hour cover through telephone. It's just a matter of facilitating that process, and I think Sohail Chaptai will probably be working on a software where all doctors can be linked up, and that will be a game changer within Pakistan as well. I mentioned about clinical guidelines. One of our consultant, Yasmin, is already working on guidelines. We've already discussed they're not fit for purpose within UK, but obviously they are definitely not fit for purpose in Pakistan. And what we want to do is modify those guidelines based on the experiences of our doctors, Pakistani doctors who know both sides and the facilities which are available, and modify them and make them fit for purpose. I'm in contact with different TV channels within UK, and very soon you will be hearing these programs. I mean, we were thinking having a London clinic, and then all, like you've seen A&E and ER programs in America and here as well, where they record programs from hospital. What we want to do is we want to show to people in Pakistan how a Pakistani doctor is actually treating a patient in Pakistan, and many of them are Pakistani patients. Is a huge difference in terms of how patients are being treated here and in Pakistan. We have APS UK Foundation, which is our charity wing, which is operational. Dr. Iqbal is not here at the moment. And JAPS is the General of Association of Pakistani Physicians and Surgeons. This is again another avenue which you will hear a lot. So there's a lot which Apps UK is doing, and obviously we want all of you to help us, support us, and hopefully, inshallah, we will take all these different streams of work, and we believe they'll make a huge difference. That's my email address. If any of you has any question or want to, give me more ideas, want to ask a question how we can do things better, and I'm more than happy to liaise with the vice chancellors from Pakistan and government representatives. Thank you.
If there's any questions, please. Yes, you raise your hand.
Can we have the mic, please, if you don't mind?
Yeah.
Is there a mic? Just next to this pillar, please.
Thank you. My name is Professor Dr. Shabir Ahmed Leri, and I am President of Pakistan Medical and Dental Council. You have mentioned few things which are related to the regulatory authority. No doubt in the Pakistan Medical and Dental Council regulate the healthcare and medical education. I am totally agree with you. Now our council has decided that those candidates who are going abroad without our job, we will not issue them a good standing certificate. We have decided. And second important thing that you have mentioned about the CME and CPD program. We are launching a CME and CPD program in 2018, which is mandatory for all doctors of the Pakistan. And third thing, I will appreciate your suggestion. If you give it to me, I will discuss it in the council and give it approval.
Thank you. That's very kind. This is exactly why we are here. Can I just mention? I think just to clarify, basically on this point which you mentioned, we had some doctors who are working here and they passed PLAB and they contacted me recently and they said we are struggling to get good standing certificate. Okay, obviously, doctors should be clarified in the beginning what the requirements are, and this should be applied prospectively rather than going in retrospect. And I don't know exact issues, but just to clarify on that point.